Hey there! You should know about the benefits of breastfeeding as well as when is breastfeeding contraindicated. Are you expecting a baby or you have a newborn? Well, congrats! If you're trying to decide whether to breastfeed or not, well, let me tell you this. Breast milk is the best nutrition that you can give to your baby. Human milk is the complete form of nutrition, especially for premature and sick babies. But there are rare exceptions when human milk or breastfeeding is not recommended. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. In this video, we will talk about the recommendations from the American Academy of Pediatrics, the benefits of breastfeeding, and when should you not breastfeed your baby. When should you not breastfeed your baby? Now, what are the recommendations from the American Academy of Pediatrics? The AAP recommends exclusive breastfeeding in the first 6 months of life, and to continue on breastfeeding after solid foods are introduced as long as you and your baby desire, for 2 years or maybe longer. So why does the American Academy of Pediatrics recommend breastfeeding? Well, it improves the overall health of your baby, as well as your health as well, mom. For your baby, it reduces the risk of SIDS or sudden infant death syndrome and also decreases the risk of overall infant death. It protects your baby from lower respiratory tract infections, severe diarrhea, as well as asthma, eczema, obesity, type 1 and type 2 diabetes, and tooth decay as well. Breast milk is the best nutrition for your baby's brain development and long-term health. And for you, mom, it protects you against diabetes, hypertension or high blood pressure, and also from cancers of the breast and ovaries. There are more benefits for you, mom, and your baby as well. Breastfeeding provides the warmth and closeness. The physical contact between you and your baby is a great bonding time. Also, breast milk is easy to digest. There are no preparations needed as well. It is readily available and it's free. It provides all the nutrients, fluid, and calories that your baby needs. And for you, mom, it helps your uterus return to its normal pre-pregnancy size. And it can also provide contraception as long as your exclusive breastfeeding, daytime and nighttime. This is within the first 6 months and your period has not returned. While breast milk and breastfeeding is best, there are some conditions where you should not breastfeed your baby or you should not feed expressed breast milk to your baby. One condition is when your baby is diagnosed with classic galactosemia. It is a condition wherein the body is not able to digest galactose. As we know, galactose is found in the milk sugar lactose, which is found in breast milk. So, if your baby is diagnosed with classic galactosemia, your baby may need a special infant formula, as well as a galactose-free diet in order to prevent complications such as jaundice, vomiting, diarrhea, or other long-term health complications. Another condition when you should not breastfeed or express breast milk to your baby is when the mother is diagnosed with HIV. HIV, or the human immunodeficiency virus, as we know, causes AIDS, or the acquired immunodeficiency syndrome. A mother who has HIV may pass along the virus to the baby through breastfeeding or through the breast milk. Although the recommendations may vary between countries, so it is better that you ask your doctor about it. Also, moms should not breastfeed or should not give express breast milk to their baby if mom has HTLV1 or the human T-cell lymphotrophic virus, because it can lead to leukemia and lymphoma and can cause brain and lung problems. Although this condition does not have any symptoms, it can cause lifelong problems and it can be passed along to the breast milk. Another condition is that if the mom has suspected or confirmed Ebola virus disease. And lastly, if mom uses illicit drugs such as PCP or phencyclidine or cocaine. Now, what are other conditions where you should temporarily stop breastfeeding? And are medications safe while breastfeeding? Well, before we go to that, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival. When you feel confident about breastfeeding your baby. When you know how to soothe a crying, fuzzy baby. When you know when to worry and call the doctor. When you know and understand your baby's sleep schedule and better take care of your baby as well as take care of yourself as well. How much better life can be when you can get the training and the comfort of your own home. Well, I've provided an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. There are certain conditions as well when you should temporarily not breastfeed your baby or temporarily not give express breast milk to your baby if, for one, you mom are infected with untreated brucellosis. Secondly, if you're taking certain medications, better ask your doctor about it. And third, if you mom are to undergo a diagnostic imaging procedure using radiopharmaceuticals. You mom should temporarily not breastfeed your baby or not give express breast milk to your baby if mother has active HSV or herpes simplex virus with lesions on the breast. If the mother has herpes, it is not passed on to the breast milk as long as there are no lesions on the breast, the other body parts with lesions are covered, and the mother performs thorough hand washing. Then in this case, it is safe to breastfeed your baby. But if there are lesions on the breast, breastfeeding is dangerous for the baby. Now, mom should temporarily not breastfeed her baby, but can give express breast milk to her baby if mother has untreated active TB disease or tuberculosis. Tuberculosis is an infection of the lungs, which is passed on through respiratory droplets. It is not passed on through breastfeeding or through the breast milk. But active tuberculosis disease puts the mother at risk for coughing, sneezing, and touching, which can pass on the tuberculous bacilli. Therefore, close contact is not recommended and breastfeeding is not recommended. What mom can do is to pump breast milk until it is safe to breastfeed baby until after 2 weeks of treatment of TB disease. But if both mom and baby have tuberculosis, then both can stay together during treatment and baby can breastfeed. Are medications safe to take while breastfeeding? Well, there are a few medications which are contraindicated while breastfeeding, but most medications are not passed on through the breast milk, and most meds have no adverse effect on your milk supply or have no adverse effects on your baby. But it is always best to ask your doctor about it. There are some meds that puts your baby at risk, and these include chemotherapeutic drugs, antiretroviral medications, radioactive iodine, some sedatives, and some seizure medications. Hey, if you found this video helpful, how about you share it with 3 of your friends who might need it? And if you like this video, watch my next video where I teach you about other child health problems.